Hi, welcome to the Watch and Whisper channel where I talk about things that are interesting to me or shows I've seen on TV that I find interesting. Well, I started reviewing Dr. Death on the Peacock channel and I've already uploaded episode 1 and now I'm going to go over the highlights from episode 2. Episode 2 starts with Dr. Henderson reviewing cases that Dr. Dunce had previously perform surgery on these patients. And Dr. Henderson is going through all of the charts and he's looking at the patients' faces and he's looking at all of the complications that the patients suffered after having surgery with Dr. Dunce. Now, from that scene, it cuts to where Dr. Henderson is listening to a conversation between him and a hospital administrator from a hospital where Dr. Dunce had previously worked. That administrator was saying that he did not turn Dr. Dunce into the medical board because what Dr. Dunce did at his hospital was there was no negligence, but he did know about the negligence that he had at the hospital prior to his hospital. However, he said when he turned in his recommendation for Dr. Dunce, when he left his facility and went to another facility, he had to base it solely on what Dr. Dunce did at his hospital, even though he knew about the problems he had at a prior hospital. So that didn't sit well with Dr. Henderson because Dr. Henderson felt like he should have been more honest with his recommendation, or he shouldn't have given a recommendation for Dr. Dunce to go to another hospital, knowing that he could possibly maim or kill another patient. So with that being said, the scene cuts to one of Dr. Dunce's prior patients, and the husband was sitting at the patient's bedside. Well, now the patient is in a coma. And if you remember, this is the husband and wife team that was sitting in episode 1, sitting in the office talking to Dr. Dunce. And he was just telling them how he was going to do this surgery and she was going to be well. Where in episode 2, you see the patient is just laying in a bed and pretty much comatose. So you can tell the look on the husband's face that he's really upset. He's going through a lot of emotions. And Dr. Henderson sits on the side of the bed and has a conversation with him. And the one thing that was so telling about how much he just loved his wife, because he asked Dr. Henderson, how after 48 years, and I've seen my wife sleep for 48 years, how can I just let her go when I look at her now and she looks like she's sleeping? And Dr. Henderson said, pretty much just told her that there's not going to be any change. Well, at that point, the husband says to Dr. Henderson, but Dr. Dunce said that he could do, I think it was a craniotomy. And Dr. Henderson told him, no, that's not going to help your wife. Her condition is too far gone. And what he's doing is just giving you a lot of false hope that there's not going to be any improvement in his wife's condition. Well, you can tell the husband looked at Dr. Henderson and he was like, but you're not her doctor. And he was listening to Dr. Henderson. However, he wasn't receiving what Dr. Henderson was saying. So at that point, Dr. Henderson told him about a situation with his son. And as the story progressed and as the episodes progress, you'll see how Dr. Henderson's son, this conversation is going to come back because they're going to show where he's having a conversation and saying how his son ultimately died in a similar situation and there was nothing he could do. So he pretty much told the husband, regardless of what decision you make, regardless of the decision you make, you're going to hate yourself for it. Regardless if you let her stay in this state and just remain in a vegetative state, or if you decide to just pull the plug and say, you know what, I'm going to let her go ahead and just peacefully transition, you're going to hate yourself regardless. And Dr. Henderson at that point was speaking from experience. And he knew what the husband was going through, even though it was a husband and wife and his was a son father. But he was a physician, so he knew it from both sides, from the physician side and from the parental side. Well, from that scene, it actually cuts over to Dr. Kirby. Dr. Kirby is in his backyard and he's doing something with his pool. But it's at that point where you see a glimpse of his frustration, the way he was trying to get one leaf out of his pool and he kept hitting at that water. That shows you his level of frustration. And there was no words in the scene, but just watching him, the way he kept attacking the water lets you know what, he's frustrated. And all of his frustration is coming from everything that's going on with Dr. Dunce. Now, the next thing that they show is, let's see, I'm looking at my notes because there were a lot of notes. The next scene cuts to Chris when he goes to college. It goes all the way back to 1991. He goes to college, and it actually shows where he first meets his friend Chris. So remember the name Jerry Summer. Chris meets his friend Jerry Summer, and they kind of show you their interaction, but it also shows where Chris shows beginning signs of his narcissistic behavior. There's a scene with him and his coach, because he plays football at college. So there's a scene with him and his coach, and you see a little narcissism with him and his reluctance to listen to what someone else is telling him. He has to be right. At that point, I say, you know what, that's very telling about his character. So just remember the scene as the episodes go on. Remember the scene where Chris is on that scale talking to his coach. And that particular scene, it progresses to where him and his friend Jerry is walking through a parking lot they were leaving out of a store. Well, that scene right there is very telling, because that's where Chris, Dr. Dunce, verbalizes that he is not, he doesn't feel like he measures up to his two brothers. Now, earlier in episode 1, you met his father. In this episode, you're actually going to meet his mother. She doesn't have a lot to say. They're having a dinner, but I'll get to that part later. But he says how he doesn't measure up to his brother, but he tells that to Chris. He says it in a way where he just kind of rushes over it, but I caught that, and that's going to be that's going to be very telling. Now, the scene also cuts to Dr. Kirby and Dr. Henderson discussing all of the evidence that they've been able to obtain up to that point about Dr. Dunce and how he's been just being a horrible neurosurgeon and really hurting his patients and not doing what he was supposed to be doing. From that scene, it cuts over to Josh. Remember in episode 1, we talked about Josh, who was the circulator nurse. Well, Dr. Henderson and Dr. Kirby actually goes to Josh's house, and you can tell Josh is surprised, like, why are these two physicians at my house? That's his look. But when he sits down and starts having a conversation with them, he's more than open about what he experienced in the operating room with Dr. Dunce, and he's talking to Dr. Kirby and Dr. Henderson. And they're telling him that they're going to go to the Texas State Board and they're going to try to have his license, Dr. Dunce's license, suspended. And they want his testimony, and they say, hey, but we want your name. And Josh is like, no, you can use my name because I'm willing to say what I saw, what I witnessed. So at that point, they're just talking about everything that Dr. Dunce did to just really maim his patients. Now, the next scene cuts to where Dr. Dunce is losing it in the OR. Dr. Dunce is performing surgery on one of his patients, and again, Josh is the nurse, and you see him losing it. Visually, you can just see he's losing it. He's just kind of just talking real flip to everybody, but at that point, you see where there is definitely something wrong with Dr. Dunce. Well, he gets so flustered that he said, you know what, just prep this room, we're going to do a craniotomy. And everybody's looking at him like, what? Everybody that's in their operating room is like, we don't have the credentials at this hospital to perform a craniotomy. He was adamant he was going to do it. So they hurried him and got on the phone and called the chief surgeon. The chief of surgery got on that phone and he called him during that operation and was telling him, hey, we don't have the privileges to do a craniotomy here. You're not going to do it. Pretty much, you need to close this patient up, transfer her care to somebody else, and then you need to pretty much get the muck out of this hospital. Dr. Dunce was hot, but that the chief surgeon was adamant that, hey, you're not going to do what you're trying to do because you can, pretty much get this hospital shut down. Everybody can lose their license. So keep that in mind where the chief of surgery tells him, no, you cannot do a craniotomy, and how upset Dr. Dunce get because, again, somebody's telling him something that he can't do. So just keep that in mind because that was very telling, and he just kind of flipped out. Let's see. The next scene cuts to Dr. Henderson and Dr. Kirby go to the Texas State Medical Board, and they were having a conversation in front of a panel, and they was showing all of the evidence on why Dr. Dunce's license should be suspended. Well, the lady that was speaking on behalf of the panelists was pretty much telling them, everything that you're giving me is hearsay. We don't have any concrete proof that this is what he has done. So in essence, they were able to, it was just a wasted trip. It was a wasted trip because the Texas Medical Board said they were not going to suspend his license because they didn't have any concrete proof. So Kirby was flying off the handle outside talking to Dr. Henderson. And at that moment, you can see how Dr. Henderson is such calm. He has a very calm demeanor, and Dr. Kirby is just always real high strung. So that's one thing that you're going to see in their friendship dynamic or professional dynamic. throughout all of the episodes. Now, the next scene cuts to Chris going back to Memphis to where he's, I think that's where he went to college, and he's meeting with Jerry, his friend. So the way the scene looked, they must have gotten out of college, and maybe Jerry didn't do much with his life, which is his best friend. Dr. Dunst comes back. He wasn't a doctor yet, and he was just having a conversation with Chris. Now, this scene actually sets the tone for their relationship throughout the series, because it was at this point where you see that the company that Chris keep is not the company that Dr. Dunst, well, Chris at the time, because he wasn't a doctor, isn't necessarily the company that he would keep. However, Jerry was his friend. This is also where you see drugs being introduced. It was a very, very subtle scene that they cut to, but you knew it was drugs. And Jerry obviously is already in the drug scene, in the party life, and Chris kind of just sat back, but he didn't, you can tell he was okay with it. So it was that scene right there that sets the tone for their relationship for the rest of the series. So just remember, there's a little bitty scene that lets you know drugs are getting ready to be involved. Let's see. The last scene of episode 2 was where Dr. Dunst, still Chris because he hadn't become a doctor yet, was back home, and he was having dinner with his mother and his father. Now, his mother was encouraging for what Chris was telling her he wanted to do, which was go to a different school. And the father was like, you know what? School costs. You pretty much tell him school costs, Chris, and you're bouncing around. You're very indecisive. You need to figure out what you want to do and stick to one thing. Well, Chris said that he was just certain that now he wanted to be a doctor. He was going to do stem cell research. Ultimately, he wanted to find a way to have disc in your vertebrae regenerate. I think that's what he was doing. But the father showed signs of not really having total faith in Chris and his abilities, because the mother suggested that Chris reach out to one of the father's friends, because the father is a physical therapist, so he's a doctor as well. The mother suggested that Chris reach out to one of the father's friends to help him do something. I don't remember what she said, but it was at that moment the father was like, no, he's not going to reach out to my friend and not be able to follow through and pay him back. Not necessarily in money, but maybe just in deeds, and maybe in his academia, he was not going to be able to pay him back. And the father at that moment let you know he didn't have full faith in his son. So that particular episode kind of ended right there, and I said, okay, I can't wait to see episode 3. So this was a really, really good episode. It had a lot of different nuggets that was dropped throughout this episode that I think is going to be really telling in episodes 3 through 8. So if you think you're interested, please go over to the Peacock channel and look at Dr. Death. I find it very, very interesting and entertaining. Nothing else. Come back to see episode 3, my review on episode 3 of Dr. Death on the Peacock channel. Have a great day. Bye, London. Bye, Bam.